you?
क्या हाल है आपका कहाँ है?
Alhamdulillah,
अमेरिका में?
I'm very good.
Assalamu alaikum everyone. I'm Hamza Hussain and it gives me an immense pleasure to extend a very warm welcome to all of you in Pakistan Cardiac Super League Season-2 powered by Wilson's Pharmaceuticals. Today we are thrilled to bring the live action of fifth match between K.T.H thrillers playing under the mentorship of Dr. Amber Ashraf Saiba and the semi-finalists of the last season, the dynamic and energetic A.K.U.H stars under the mentorship of Dr. Saira Bukhari. Before diving into the excitement of the match, allow me to introduce the panelists, the senior faculty members who have graced us with the presence. We have with us the match umpire, Professor Mohammad Ishaq, a distinguished cardiologist, and is joining all the way from the UK, and he will be the match umpire of today's match. And we are honored to have Dr. Suhail Khan, a world-renowned cardiologist, intervention cardiologist, and he's currently serving as a intervention cardiologist at Queen Elizabeth Hospital, Birmingham. And we are honored to have you with us, sir. And secondly, we also have the patron in chief of Cardiac Super League, Professor Fawad Farooq, serving as a professor of cardiology at NSCVD Karachi. And we also have with us Professor Amber Ashraf Sahiba Sahab. She is also the mentor of K.T.H Thrillers and also among the founding members of Pakistan Cardiac Super League Season 1. And another prominent personality from Sawat has also joined us today, Professor Hafizur Rahman Sahab. He's Professor of Cardiology and the Head of Department at Sidhu Teaching Hospital, Sawat, and he's also the Chapter Coordinator of Pakistan Cardiac Society, Sawat Chapter. And last but not the least, we also have with us Professor Abdul Hamid Siddiqui Sahab. He's former professor of cardiology at FIC Rawalpindi, and he's also the match umpire of today's match. And in last but certainly not the least, I will now introduce the moderator of today's program, Dr. Hamza Wadi. He is serving as an assistant professor of cardiology at Rawalpindi Institute of Cardiology. And I will now hand over the microphone towards Dr. Hamza to please to start the formal proceeding of today's match. So over to Dr. Hamza.
Thank you very much, Hamza, for starting the proceedings like always, and we're also grateful to you. So I again welcome all of you for this second season of Pakistan Cardiac Super League in collaboration with Pakistan Cardiac Society and Wilson's Pharmaceutical. So today we have another important league match, and it is going to be held between A.K.U.H University Hospital Stars versus K.T.H Khyber Teaching Hospital Thrillers. So let's see how thrilling it gets. And we all know it's a hot sunny day everywhere, and it's going to be a pretty bouncy, straightforward pitch. So I'm expecting a pretty high score, to be honest. So with this, I move to our dignitaries, our panel of experts today, and we start with Professor Hafizur Rahman. We welcome you, sir, Professor Fawad Farooq, and we also have Professor Amber Ashraf. I welcome you all. And definitely, it's not possible without our umpires for the game today. And we have Professor Mohammad Ishaq Saab, welcome sir. We have Dr. Abdul Hamid Siddiqui, like always, he's there in full support. And we are also pretty excited to have today Professor Dr. Suhail Khan from UK. So welcome to all the dignitaries. And with this, I now move to the two teams that we have. and I will request one of the captains of the teams to start the introductions of the teams. So I will start with K.T.H Thrillers and their captain to give the introductions, please.
Assalamu alaikum and good afternoon, everyone. I am Dr. Gibran. I am PGY4 cardiology in Khyber Teaching Hospital, Peshawar. I am the team captain of K.T.H Thrillers. And should I also introduce my team members?
Yes, please. Sure.
Yes.
Okay. So sitting on the right is Dr. Ashfaq, who is also a PGY4. Then Dr. Emil, who is PGY3. And Dr. Asam, who is also a PGY4 resident. So we are 4 members in our team, and we look forward to inshallah win the match, to have a good match.
So well done and best of luck to you. We now move
Thank
to
you, sir.
A.K.U.H Stars. Can we have the introductions? Captain, please.
Assalamu alaikum. I'm Dr. Umair Javed. I'm the chief resident here. And to my right, we have Dr. A.K.U.H Mahmood with us. And to my left is Dr. Rizwan Ali Khwaja. And we also have Dr. Anna Said. Good luck to the team, and hopefully we will win.
Yes, well done and best of luck to both the teams, and we are looking forward to a good match today. So with this, we move to the toss now. So can we have the electronic coin toss? And I'm going to randomly ask one of the teams. I think we'll go ahead with A.K.U.H Stars to pick either heads or tails.
Heads.
So heads it is. Please roll the coin. And it's a heads. Okay, so you won the toss. But with this, you will have 2 important questions. The first one, whether you want to take the questions or you want to throw the questions.
We would like to throw the questions first.
Okay, so they have decided to throw the questions first, and the second part of this thing is to go either with one of the 2 scenarios. So you will have case A or case B. So what do you want to pick, Stars?
We will take case A, and we will be asking K.T.H to take case B.
Okay, so the news from the center is A.K.U.H has won the toss, and they've decided to take the option A with the Vignes, and they are going to throw the questions. So can we have the first question on your screen? Can you read the question, please?
So this is the case A, so we took the case A actually, but yeah, that's fine. So
Okay.
an 85-year-old
So whatever you
man,
pick, you will have to go with it. So you've decided to throw the question, so you will throw A. That's
Okay.
random selection.
Okay. Okay, can we have the case?
Yes.
Okay, so case A is of a 85-year-old man who presented to emergency department with increasing dyspnea and malaise. 5 years ago, he had tower for severe aortic stenosis. He reported increasing fatigue, dyspnea, and a low-grade fever for past 7 days. On exam, his temperature was 106 degree Fahrenheit. Heart rate was 98 beats per minute. Blood pressure was 112 over 50 millimeter mercury. Respiratory rate was 18 per minute. Pulse oximetry showed 96% saturation on room air. He had normal S1 and S2 heart sounds with 2/4 decreased murmur present along the left sternal border. His lungs were clear. The remainder of his physical exam was normal.
Okay, so you can still take some time. I'll ask our thrillers. Once you're ready with the Vignes, we'll go ahead. So you can take a few seconds to read it. So thrillers, do tell me when you're ready for question number 1.
Are we going to take the case A because the A.K.U.H team said that they would like to opt case A for themselves and case B for us?
Okay, so they wanted to throw the question that was random selection. So whosoever either throws or takes the question will pick a case. They can either throw it or they can take it. So they picked A. That means they are going to throw question A, and that's for you.
All right.
I hope I've made it
Oh,
clear.
okay, fine, sir.
All right, please.
Okay, sir.
Can we
Okay,
have
sir.
question number 1, please? You can always go back if you want, and we can show you the Vignes. All right.
So I'm going to read the question. Question number 1 is, in addition to a transthoracic echocardiogram, which of the following is the most appropriate next step in the management of this patient? Option A, empiric antibiotics. Option B, obtain 2 set of blood culture. Option C, administer intravenous furosemide. Option D, an influenza nasal swab. And option E, a chest X-ray.
And you have 60 seconds to answer. Timer starts now. I will also request all the members who are on board to please mute their mics because we can still hear a lot of crosstalk. Thank you. The teams should keep the mics open because we would like to hear you.
C, B or C के देगा ना? Why not C? Why not C?
20 seconds.
Just clear होगा ना? बस B, I think B.
15.
Lock.
Come on.
Option B, sir.
B. Obtain 2 sets of blood cultures.
Yes, sir. Option B.
B beta.
2 sets
So
of blood
lock
cultures.
option B. Yes. And well done. That's a wonderful start. So you've started off by hitting a big 6. Well done. Great job. Moving on to question number 2 on your screen.
30 seconds कम से कम
Question number 2. Which of the following would be an indication to perform a transesophageal echo? Option A, atrial fibrillation. B, Streptococcus bovis bacteremia. Option C, worsening pulmonary edema. D, persistent fever after 48 hours. And option E, acute deep vein thrombosis of the femoral vein.
And your timer starts now.
30 minutes, 30 seconds.
Persistent fever.
So are we going to have another 6? Let's see.
E, I don't think E dora likely. Persistent fever after 48 hours.
15 seconds.
A, why not A? Clot the para.
8 seconds. Come on, hurry up.
Option
5.
D, sir.
Option D.
D,
Lock-
sir, D. Yes,
D for
persistent
delta.
fever for after 48 hours.
Okay, option D, delta. Lock it, please. Let's see. Oh. So you got close, but then again, yet so far away. Yeah. So that's definitely the incorrect answer. But never mind. You will have another 8 questions to deal with. So can we have the next question, please?
Question 3. His blood culture were reported positive for Streptococcus bovis. Which of the following studies should be performed next? Option A, CT of the abdomen and chest. Option B, fecal immunochemical test. C, no further testing is needed. D, Golak fecal occult blood test. And E, colonoscopy.
Let's सोच लो कि कहना यार डायरेक्ट दागमा करेगा ना वो इस
Timer starts now.
No further testing is needed. सोचो क्या ख्याल है सोचो कि think about it. Why not A? CT of the abdomen and
bovis अक्सर does CA in the body. CA colon वगैरह
colon study should be performed next.
85 age होगा ना colonoscopy
Colonoscopy A वाले ना दे A, why not A?
A सर colon नखकारी कना A सर colon नखका A सर
ना हाँ
CA colon नशोस bovis चीज़ें CA cancer
A मान देंगे dissemination of the stage imaging अगर किसी में
primary focus
Option E, sir.
Okay.
E for elephant. Option E.
E, colonoscopy.
Option E. E for elephant. Yes, sir. Colonoscopy.
Okay. E, lock option E then. Yes. So Very right, very right. I think this was a full toss and deserved to be hit out of the park. Well done. I really enjoyed your discussion in the end, but well played. So moving to
A humble request to KTH thrillers that we do enjoy their discussion among themselves. So if they would discuss in Urdu English, then we would understand what they are discussing. So that
Dr.
sounds
Fawad, Dr. Fawad, can I say something? Let
Yes.
them
Yes,
to
ma'am.
discuss in Pashto, otherwise they're unable to pick the answer, please. Thank you.
सही है हम उर्दू
do
में
I
भी कर
do
सकते
I
हैं
need
हम
to go
उर्दू
to
में
the
कर लें
umpires for this?
नहीं,
मसलन सही था सही था
Allowed.
Comfortable,
Hamza, allowed.
comfortable, please. उसमें
Right,
रहो.
sir.
Thank
Right,
you.
so
That
right,
type
so
language allowed.
right, sir. The verdict has been given by the umpires. So thank you very much, sir. And we now move on to the next question on your screen.
Question number 4. For which of the following procedures should he take antibiotics as prophylaxis against infective endocarditis? A. Fat bed biopsy. B. Esophageal gastroduodenoscopy. C. Cystoscopy with urethral dilatation. D. Dental cleaning. E. Colonoscopy with biopsy.
And timer starts now.
ए तो एक्सक्लूड कही है ना मोर ऑप्शन डी एक्सक्लूड का डी
I think
कोलोनोस्कोपी में एक्सक्लूड का बी के अक्सर खलक वर्क बी सी को माता ने दिया सी सिस्टोस यूरिथ्रल डायलेटेशन के यूरिथ्रल डायलेटेशन बल छे कही वो उसने कही है ना बल बैक्टीरिया
I think that's C. I would like to go for C. ما تلقى غير MRCP كده. This was one of the questions. كنا C أو E كذا لغين.
elected biopsy को ना
No. C
20 seconds.
मतलब डी ओ सी की
E أو E हो गया. E
वोटिंग पे
just C कर दाओ. C. अशफाक वाया.
10 seconds. Come on.
Okay, option B, sir. B for ball.
B for ball. So they want to go for option B. Lock the option B, please. B. Oh. Oh my goodness. Well, I thought this was going to be flicked over square boundary for a big 6, but then again, it turns out it was an off swinger, an out swinger rather. So, never mind. We have the next question coming your way. Question number 5.
References of the last question.
Question number 5. Which of the following is required prior to dental procedures in these patients? A. No antibiotic prophylaxis. B. Clindamycin 600 milligram. C. Ceftaroline 1 gram. Option D. Amoxicillin 500 milligram. Option E. Metronidazole 500 milligram.
And your timer starts now. So don't worry if you ever have any doubts. I think there's a counsel here and we'll provide you with the references also as needed.
मेरा D O B. No, B work कही. How work कही.
Amoxicillin
B O D. I think D. Some D for bio.
clindamycin first line बोल के देखिए empiric thing.
So what do you think? D. D.
D
D O D. Then
डिपेंड
D for dog, sir. Amoxicillin 500 mg.
Okay. So you want us to lock option D. Lock it, please. Oh. Well. That's another miss. So, it's turning out to be a tough over. Never mind. You've got to be more careful with the next question. On your way. Can we have the next question, please?
Question number 6. According to American Heart Association guideline for the prevention of infective endocarditis, in which of the following cardiac condition antibiotic prophylaxis is not required before invasive dental procedure? Presence of prosthetic cardiac valve. Option B, unrepaired cyanotic congenital heart disease. Option C, cardiac transplant recipient with cardiac valvulopathy. Option D, mitral valve prolapse with audible murmur and severe MR. Option E, previous episode of infective endocarditis.
And your timer starts now.
Serum B.
A,
B.
B, no,
B.
A, B, E indication. C O D के D, C. For cardiac transplantation recipients with cardiac valvulopathy.
D भी आ गया तो audible murmur. D. I think D.
Okay, so approaching 10 seconds now. Hurry up.
Option D, sir. Mitral valve prolapse with audible murmur and severe MR.
Okay. Lock option D, please. Let's see. Yes. Well done. So finally we get a 6. And I think now from here on you can still get a good score. So, keep your hopes high. Next question, please. On your screen. Question number 7.
Question number 7. Which of the following is a member of fastidious slow-growing group of archaic organisms that cause endocarditis? Option A, Haemophilus parainfluenzae. Option B, Aspergillus fumigatus. Option C, Campylobacter jejuni. Option D, Enterococcus avium. And option E, Klebsiella pneumoniae.
And your 60 seconds start now.
Campylobacter. Avium.
6 no tool rise.
Campylobacter हम बग रहा है.
Another tool is slow growing या देखनी.
गट वाले चेक हमने avium नहीं कबो बेचते का ना.
ما تخكاري Klebsiella هو بكينا ده أغيك كينجلا ده. Klebsiella بكينا ده. أغيك كينجلا ده.
और avium
كينجلا ده أغيك كينجلا ده.
avium
B A ده كنا. Aspergillus हम ده هو ده كنا.
20 seconds.
Enterococcus avium हम يعني A ده.
A.
10
Option
seconds.
A, sir. Haemophilus parainfluenza.
Okay, so lock option A. Yes, very well done. So that one goes out of the park. It's a straight drive for a 6. And I tell you, I could see the stars. They had a smirk on their face. In fact, they thought it would be a googly, but I think you've played it very well. So we move on to the next question.
When they discuss in Pashto, they come with the correct answer.
That's again, I think that's a wonderful finding, sir. You're a keen observer. We all know.
Yeah.
And thank you very much. And so let's see. Next question on your screen.
Question number 8. In Loeffler endocarditis, which of the following is an expected finding? A. Hypertrabeculation of the LV myocardium. Option B. Accompanying aortic dissection. Option C. Asthma and nasal polyposis. Option D. Eosinophilia. Option E. Markedly reduced left ventricular ejection fraction.
And 60 seconds start now.
लग सोच पे
Surprise D.
सी बारी के साथ ख्याल है
C Loeffler زغده يودرس لرده Loeffler أسمع ونقدر بوسي زغده بيل شيء يعني سام ترس ده بيل شيء markedly reduced EF for eosinophilia maybe غلط لا hypertrabeculation
यार दम
كم option زين تاول راشي بور كي بيو بقدر تشيرن كي
خير بدي نو हम सोच ना टाइम लाटियर रहे
exclusion का كنا C مباسا aortic dissection
So approaching 20 seconds.
إنتي مباسا إنتي مباسا أنا بيام دي باتي بس بدي ورثة.
Option number D, eosinophilia.
Are you sure you want me to lock it?
Yes.
Yes, sir.
So they are confident. Lock option D. Yes, and their confidence was spot on. Very well done. Another 6 runs. Great going. So I think this is going to be a reasonable score if you keep going like this. Can we have the next question on your screen?
Number 9. What is the most common complication of infective endocarditis? Option A, stroke. Option B, embolization other than stroke. Option C, heart failure. Option D, intracardiac abscess. And option E, intracardiac fistula.
And the timer starts now.
What about the abscess? abscess था आपकी
Most common याद है
most common
nothing other than stroke failure
failure
सही
ना
देखा embolize की का नोर्स
यार एपिसोड शो पे गया बड़ा डिस्कशन वो करें 10 minutes
stroke included embolization heart failure nothing पूरी embolus होली spleen theory दांडी renal theory बड़े होली no stroke including stroke देखना heart failure सही क्या heart failure या CDK heart failure cause कहीं
abscess fever में और दो चीजों हम करें
20 seconds.
Heart failure
Come on, K.T.H. You can do it.
abscess बारी के साथ ख्याल है abscess
most common
10 seconds.
CDQ
C
Hurry
सही
up.
देखा ना वैसे ही
Which one?
option C sir heart failure option C heart failure
Okay. Lock option C, heart failure. Oh, yes. Very well played indeed. That was very nicely done. I think definitely your Pashto is working for you, no doubt. So, I think we're getting competitive. Can we have the next question on your screen? And this happens to be the last question of this
Question
innings.
number 10. With regard to the use of 18F FDG PET CT for the identification of infective endocarditis, which of the following statement is false? A. Vegetation can be visualized with 18F FDG PET CT. B. Vegetation are seen as small foci of increased 18F FDG activity in the region of infective valve. C. 18F FDG PET CT is highly sensitive to rule out native valve endocarditis. Option D. 18F FDG PET CT may contribute to the detection of downstream septal emboli. Option E. None of the above.
The timer starts now. It seems like a bouncer. Let's see.
देखिए ميكانيكال خلاص بري سيكينو ده سيم بتا غلط دي ميكانيكال بقشت سخبه ديك هو كانت هايلي سنسيتيف تو رول دي وچ فالس کم یو ميكانيكال بقنيشت دي نت وال سی ور کړه ده ما غلط دا و
oh D what about D
may contribute to stream دا وال د پاره ده دا اف डी جی چې کوم پټ سيټي ده ميكانيكال سخه ده ريلیټ کې ميکانيکال څنګه خدي ما ته وډی کاری
highly sensitive not contribute to reduction of downstream
20 seconds.
لا ما تمدير ولا بيتوريا زيرو ولا سي دي كي دي دير ما تقول
Approaching 10 seconds.
positron emissions
Come on. If you play this one well, it's going to be competitive. 6, 5, answer.
option number D sir option
Okay,
D for
just
dog
at the last moment. It's option number D. Lock the option, please.
mechanical
Oh, and yes, somebody said C. So, again, that was a high ball. It was a bouncer, turns out. It was a slow bouncer. But well played in the end. So, we come to the end of the first half, the first innings. And I think this was well played by K.T.H Thrillers. I think this is going to be a good score. And let's see how Aga Khan performs. But before that, I would like to move towards my panel of experts. And first of all, Professor Mohammad Ishaq Saab, sir, your opinion on the score?
Well, very well done, K.T.H. I think it was very well structured question. They answered very well. When they were talking among themselves in Pashto, they were doing good. I hope they had taken some Naswar also, then there would have been no wrong answers. But I think overall, good performance by K.T.H. One or two questions are a bit difficult, but then we can't have all the 10 questions easy and straightforward. The topic was very practical, routine topic, and well-structured question. So I think overall they did very well. So let's see how the A.K.U. guys respond.
Thank you very much, sir, for your input. Some wonderful points. And now I move to Dr. Suhail Khan to have his thoughts. Are you there, sir?
I am. Thank you very much for the invitation to join you today. I've really enjoyed the first innings here. I have to say the questions were challenging, and these are meant and designed to be challenging so that we really bring out the best in the junior doctors here. I'm a bit disappointed. I think the team will also be probably a little bit disappointed that they didn't score more here, but they've got 6. I think it is a reasonably competitive score, and we'll have to see what Aga Khan can do in terms of responding here.
Very right, sir. Thank you very much. And I would also request Professor Amber Ashraf to have a word from her if she's there. Ma'am, are you there?
Yeah, sure. I'm around. Thank you very much. The question and stuff, that was really nice. Team played very well. Let's see what A.K.U. Team is going to perform. But always be positive. In तमाम मैचेस में हार और जीत नहीं होती. That is only the way we are learning and improving our knowledge, skills, and rest of the thing. Good luck. Thank you.
Thank you very much, ma'am, for your words. I think this is how it is. It's a competition, and we win some, we lose some. It's the competition that's important for us. So I now request Professor Dr. Hafizur Rahman. He's also with us. So if we could have a few words from him. So we have Professor Meet Siddiqui Saab, sir. It's great to have you.
Can you hear me, please? Can
yes,
you hear me?
Okay, yes, we can hear you, sir. Professor Hafiz Rahman, yes, Hafizur Rahman Saab.
Assalamu alaikum, Professor Ishaq Saab and Professor Amber Saab. It's nice to see you. It was a wonderful activity, and K.T.H played very well, although infective endocarditis is a comparatively tough topic in cardiology, but they played reasonably good, and let's see how the Gahan play. Thank you very much.
Very right, sir. So definitely it's a competitive score, and I did see Dr. Abdul Hamid Siddiqui on the screen, so I'd like to have his thoughts as well.
I think fighting score put up by K.T.H. Let's see what Khan University stars do further.
Sure, sir. Fawad Farooq Sahab, I know I'm missing you, and you also know it. So where are you?
I'm here.
Great to have you.
I think all being said, but one thing which I really appreciate the Wilson, the technicalities. There's no hiccups, very nice technical support, right windows, right person focused. So good luck to them. With every passing match, we are improving in terms of question, answers, knowledge of the teams, and the technicalities. Over to Hamza.
Thank you, sir. Alhamdulillah, no doubt things are moving smoothly, and all thanks to Wilson's Pharmaceutical and the technical team. A lot goes into it, as we all know. So with this, we move to our second innings. So are we ready with the game? Okay, so can we have the scenario on the screen, please? And K.T.H Thrillers are going to read it for us. Please.
All right, so case B. A 22-year-old woman presents to routine follow-up of mitral stenosis. She was hospitalized with a prolonged febrile illness at 13 years of age. She currently runs 6.44 kilometers in 35 minutes, several times per week. She denies palpitations. She is on no medication except birth control pills. On physical examination, she is 170 centimeter tall and weighs 57 kg. Her blood pressure is 122 by 72 millimeters of mercury, and heart rate is regular at 76 beats per minute. Her lungs are clear. Her JVP is 4 centimeter of water. S1 is increased. Both components of S2 are normal. A soft early diastolic rumble is present that is preceded by a crisp opening snap. No peripheral edema is present. Her echocardiogram shows fusion of the mitral commissures. The mean transmitral gradient is 4 millimeters of mercury at a heart rate of 88 beats per minute. The calculated mitral valve area is 2.3 centimeters square by the pressure half-time method. Trivial MR is present. The mitral valve appears pliable. Echocardiographic score of 4.
Okay, so stars, you can have a few seconds. Let me know when you're ready.
Question
Follow-up, routine follow-up.
Okay, so are we ready? Stars. Okay, so can we move to question number 1, please?
Read
Read the question, please.
Question 1. Which one of the following is the best next step in the cure of this patient? Daily prophylactic oral penicillin V, vitamin K antagonist therapy, percutaneous balloon mitral valvotomy, surgical mitral valve replacement, and option E, transesophageal echocardiography.
And 60 seconds on your screen.
Vitamin 22-year-old. At 13 years of age, she had the febrile illness. So vitamin K की need PTMC की surgery doesn't but we will need a transplant to follow up when we need, but वो तो करवा देंगे daily prophylactic oral penicillin हर I guess. So I don't think. So we will go with the option A, daily prophylactic oral penicillin V.
Okay, so you really want to go ahead and want me to lock it?
Yes, sure? Yes, please.
Option A, right?
Yes.
Okay, lock option A. Oh yes, well done, out of the park. It's a huge 6. I think you knew it and you were very sure. Well played. So a good start. Can we have the next question on your screen, please?
Question number 2. 2 years later, she presents to your clinic for pre-pregnancy counseling. She denies any cardiac symptoms. Her only medication is a monthly penicillin G injection. An ECG reveals sinus rhythm. An echo shows LV ejection fraction of 65%. There is left atrial enlargement. The mitral valve leaflets are thickened with commissural fusion. There is no calcification or subvalvular thickening. The mitral valve pressure half time is 170 milliseconds. Which one of the following is the best recommendation for this patient? Option A, prescribe metoprolol 25 mg twice daily. B, refer to balloon valvuloplasty. C, advise against ever becoming pregnant. D, initiate lisinopril 5 mg daily. And option E, proceed with pregnancy.
And start the timer, please. Okay, so we have Professor Javed Akbar Syal Saab. Welcome to the show.
Pregnancy.
Thank you, Hamza.
Pressure after 170. Severe, but she's not symptomatic. We should pregnancy balloon करवाना. उसको तो symptoms नहीं है. Advice against
20 seconds. Come on. 10 seconds. Hurry up, stars.
Let's go for pregnancy. I think E.
E.
Proceed with the pregnancy.
Okay, so lock option E.
Yes.
Oh, that's the first missed delivery. All right. Never mind. So I think this is the first miss. We still have a lot to play for. I think it's going to get tougher with every question that comes our way. So moving to question number 3. Can we have it on the screen?
What happened to the previous question?
Question number 3.
Yes, it was a wrong answer.
She lost.
It was a wrong answer.
Yes, it was a wrong answer.
She lost to.
Haven't noticed the pressure half.
She lost to follow up and didn't undergo balloon valvotomy. Now she's 26 weeks pregnant and presents to the emergency department with a 2 weeks history of progressive dyspnea and palpitations. Her examination reveals an irregular heart rate of 140 beats per minute with a BP of 95/60. Her GBP is 4 centimeters above the sternal angle. Her lungs are clear to auscultation with no peripheral edema. LV ejection fraction is 60%. The mean mitral valve gradient is 12 mm mercury at heart rate of 88 beats per minute. The mitral valve area is 1.3 centimeters square. There is mild MR. In addition to anticoagulation, which of the following is the next best step in the management? Urgent direct current cardioversion, metoprolol tartrate 20.5 mg every 6 hours, sotalol 80 mg twice daily, percutaneous balloon valvuloplasty, verapamil 40 mg twice daily.
60 seconds on your screen. you can make a big match out of it. We can't hear the stars actually. We don't hear any discussion. Is their mic on mute? Aga Khan, are you there? Okay, we can hear them now. So you're approaching 20 seconds. Come on.
So we will go with the option B. Metoprolol tartrate 12.5 milligram every 6 hours.
All right. Lock option B. Oh yes, it was a quick delivery, but you have fended it off very well for a 6. Well done. Great play. Can we move to the next question, please?
She presents 6 weeks later at 32 weeks pregnancy with dyspnea. Her vital signs are a heart rate of 102, a BP of 100/60. Her physical examination reveals bilateral rails 2/3 of the way up the posterior lung fields. There is an elevated JVP to the angle of the mandible. Her echo reveals normal LV function, transmitral valve gradient of 16 millimeters mercury at a heart rate of 90 beats per minute with trivial MR. In addition to diuresis, which of the following is the best next step for the management of this patient? Percutaneous mitral commissurotomy now, IV metoprolol 5 mg every 6 hours, delivery followed by MV replacement, percutaneous mitral commissurotomy at 36 weeks, MV replacement followed by delivery at 38 weeks.
Okay, the timer starts now.
She's 32 weeks. Which is the time frame where she can have a viable fetus. But we don't need to replace the valve. We need to pliable valve. I'm not sure
Approaching 20 seconds. 10 seconds, come on.
So we will go with the option A, percutaneous mitral commissurotomy now.
Okay, so lock option A, please. Oh, yes. Very well played. That's beautifully played. I think it's a cover drive for a 6. So nicely done. I think the game is getting closer. It's going to be a good match as far as I can see. Well done. Well played. So can we have the next question on the screen? Question number 5.
Which of the following statement is true regarding radiation exposure during pregnancy? Pregnancy is an absolute contraindication to cardiac fluoroscopy. The procedure can be performed safely as long as proper shielding is applied to the abdomen and pelvis. The radiation hazard to the fetus is very small and shielding is not necessary. The most likely adverse effect is intrauterine growth retardation because rapidly growing tissues are extremely sensitive to small doses of ionizing radiation. PMBV can be safely be performed in 3rd month of pregnancy and afterwards.
Okay, the timer starts now.
We have to find it. So the A is the right. D or E. That procedure can be performed safely. We can radiation at the most, but we are not very sure how safe it is. Simply we the most advanced IUGR. I think. But small doses of ionizing radiation, the question can also be right. That's that.
20 seconds.
E and D is the thinking, right? So that's what we do.
10 seconds.
So we will go with the option B. The procedure can be performed safely as long as proper shielding is applied to the abdomen and pelvis.
Okay, so option B to be locked. Oh, well. That was a tricky one, I know, but again, I think it was, there was a lot of discussion going on. You tried your best, but still missed in the end. Never mind, it's still a
Hamza,
close contest.
this was a googly.
It was definitely a googly, and but I guess we all know what the answer is. But still very well played in the end. It's going to be a good game. So next question on your screen.
Which of the following statements regarding the auscultatory findings of mitral stenosis is correct? The opening snap is late diastolic sound. A long A2OS interval implies severe MS. In atrial fibrillation, the A2OS interval does not vary with cycle length. The snap is generated by rapid reversal of position of the posterior mitral leaflet. The presence of opening snap implies a mobile body of the anterior mitral leaflet.
Okay, so timer starts now. So after 5 questions, both the teams, they have scored equally, 18 apiece.
Earlier ज़्यादा होगा. O2 diastolic sound came नहीं late diastolic sound. If में does not vary with the cycle length. Why would it vary? A2 Snapple.
Approaching 20 seconds.
So this is the good thing for the price.
10 seconds, come on.
So we're going with the option E. The presence of opening snap implies the mobile body of the anterior mitral leaflet.
Okay, so option E it is, the last option. Yes, that was very nicely played. You hooked it out for a 6, to be honest. Very well done. And we were hoping for this answer. Well done, well played, played like stars. So next question on your screen now.
Which of the following statements regarding percutaneous balloon mitral valvuloplasty is true? Balloon mitral valvuloplasty is the treatment of choice for patients with hemodynamically significant MS without left atrial thrombus and an echo score of 12 or less. Transthoracic echo is the most appropriate imaging study before the procedure to exclude the presence of LA thrombus. Balloon mitral valvuloplasty is the treatment of choice for patients with hemodynamically significant MS without LA thrombus and echo score of 8 or less. A small ASD is detected in 25% of patients after procedure. Approximately 10% of patients develop severe MR as a result of the procedure.
60 seconds start now.
वो सही है, we agree. Go with the option C. A small atria
ये दोनों confusion के लिए दोनों मुझे D और
10% get severe MR as a result of the procedure.
what's the we don't know, but the correct answer is C. Balloon valvuloplasty treatment of child with hemodynamic significant MS with
that seems like the right answer.
C.
But the Wilkins score has to be 9 or less.
So 5, 8 or less. 8 or less.
But is that the trick?
No, go for it. Go for it. We are ready.
We have 10 seconds.
Approaching 20 seconds.
We're going to answer it. Okay, ठीक है. So we're going with the option C. Balloon mitral valvuloplasty is the treatment of choice for patient with hemodynamically significant MS without LA atrial thrombus and echo score of 8 or less.
Okay, so you want us to lock the option C? Okay.
Yes, sir.
Lock it. Very well done, well done. The whole camaraderie was fantastic, the way they were discussing it, but then in the end came up with the right answer. So yes, it may just go to the wire. Well done, well played. You've got 3 more questions. To beat them, you need 2 right answers. So best of luck to both the teams and move to the next question.
3 ball, 2 sixes.
Sure.
Which of the following statements regarding the medical management of MS is not correct? Diuretic therapy is an appropriate measure for relieving symptoms of dyspnea. Antibiotic prophylaxis is recommended for patients with rheumatic MS undergoing dental surgery. In pure MS with normal LV function, digoxin is of clinical benefit only if EF is present. Beta blocker therapy for patient with MS improves exercise tolerance. Beta blockers improve exercise capacity in patients with MS in sinus rhythm as well as in those with EF.
And the timer starts now.
Not correct. We have to find the non-correct variant. So A is fine. Go with the B MS के अंदर rheumatic MS के अंदर prophylaxis का क्या था?
Rheumatic MS होने
ठीक।
rheumatic heart disease.
But for the antibiotic for the procedure.
हाँ, yes, sir.
Your,
Rheumatic है.
अच्छा, third is digoxin is only beneficial if AFib is present. That's also
That's
correct.
fine.
Beta blocker therapy for patient is exercise preventing patient with MS and sinus rhythm as
Approaching
well as
20
those
seconds.
with why?
Because देखो अब बाकी सारी चीजों में तो मैं
I think the but it is
10 seconds.
regular. I think B.
Stars, come on.
अभी सब क्या कहते हो?
5.
We're going with the B. Antibiotic prophylaxis is recommended for patient with rheumatic MS undergoing dental surgery.
Okay, lock option B. Yes, well done. That's a fantastic answer. I think this was very well played in the end, and now you are just in scores are level. Well done, well played. You just need one question, one right answer in 2 questions. So I think K.T.H Thrillers will have to really bowl it tightly. Let's see how it goes. We have the next question on your screen.
In a patient with severe MS, which one of the following is not an indication for balloon mitral valvuloplasty based on the current American College of Cardiology valvular heart disease guidelines? Progressive dyspnea on exertion, new onset AF, evidence of hemodynamically significant MS during exercise, pulmonary hypertension, asymptomatic with MVA less than 1 centimeter square area.
Okay, your timer starts now.
Pulmonary hypertension होता है not an indication देखना है AFib की वजह से हम करना होता है so
खराब जिसमें मतलब खराब हो रहा है
asymptomatic with
आज पे मैं इसी पे या टीम है सर हाइपरटेंशन में आप
Okay, so less than 25 seconds. Is this going out of the park for a 6? Let's see.
or there is ठीक है
We're all tied to the seats. 15 seconds. 10 seconds. Come on. 6.
So we will go with option E, asymptomatic with mitral valve area less than 1 centimeter.
Okay, so you want to go with option E. Lock option E. Oh. Well. Turns out it was an in-swinging Yorker. So that makes it very interesting. So we have gone down to the wire yet again.
Are we heading to super over?
Oh yes, we're not going to have it now in this phase of the league, but we may have it in the second phase of the league. So we're moving to the last question now. If you answer it correctly, Stars, you are through.
Which of the following is true regarding the presence of spontaneous LA contrast? It is most often associated with severe MR. It is an indication of the need for immediate valvuloplasty or valve replacement. It is often associated with LA appendage thrombus. The presence of smoke in the LA contraindicates a mitral valvuloplasty due to a high risk of embolic stroke. It should be treated with long-term antiplatelet therapy.
Okay, timer starts now. Thrillers, keep your hopes high. Come on, it could still be a tie.
We
don't want to see your shoulders getting dropped.
Indication for immediate valve नहीं ठीक है तो एक out हो गया. It is often associated with LA appendage. That can be a possibility. The presence of smoke contraindicates नहीं. We do it ठीक है and it should be treated with long time. So we are going with this
30 seconds.
So we will
25 seconds.
So we will go with option C. It is often associated with LA appendage thrombus.
So you still have 10 seconds. Option C. You want me to lock it?
Yes, sir.
Option C. Okay. It has come down to the wire. Lock option C. Let's see. And yes, very well done. Wonderful end. Very well done, Stars. So Aga Khan has sealed the deal beautifully in the end. But I must say it was a wonderful game. We had a great competition today. And Wonderful. I think Stars, they took it in the end, but Thrillers also played very well. And congratulations to the Stars, commiserations to K.T.H Thrillers, but it's the game that matters in the end. And with this, I now move to our experts, and I think first I would move toward Dr. Suhail Khan. Can we have your thoughts regarding the game today? So if he's not there, then Professor Ishaq Saab. Okay, he's there.
Suhail, no, Hamza, Suhail Khan is there. I think.
Yes. Sorry, I was just had difficulty finding the mute button. Can I just say it was an excellent match there. Unfortunately, only has to be one winner. And congratulations to Aga Khan. It went down to the wire really on the last ball, but we had a fantastic innings by both teams. So really well done. They should be very proud of their performance. And commiserations to the Thrillers. They did put up a very good fight here, but unfortunately just got pipped at the post.
Thank you very much, sir. Great words. I think your presence gives a lot of support and courage along with guidance to our students and all the cardiologists. Even I think we are learning a lot from the game, as we all say time and again. And it's great to have you once again in this season. And with this, I move to Dr. Fawad. I saw him there, so I just, can we have Dr. Fawad Farooq? Your thoughts, sir?
Yes, I am there. I think I enjoyed a lot. It's really all are winners in a way, putting a very exciting match for all of us. So both teams are winner for this kind of thrilling match. But at the end of the day, one has to win and one has to lose. So I congratulate Khan. Few technical advices. One is the housekeeping for our experts to keep their mics mute while the proceedings are going on. Secondly, when the teams are answering a question, your answer options should be on large screen. That is for Wilson technical team. Usually it's on Facebook, you have that window of answer option on the large screen. But here what happens, you put your teams on the large screen and your answer option went on to a small window. So we do also try to answer things. So if it kept on the large screen, the answer options which are there and teams are trying to hit. So that would be better as compared to keeping the team on large screen and putting your answer option on the small screen. And lastly, that Pashto matter, actually, I'm not really anything about Pashto. Actually, these things are recorded and we do enjoy this conversation. And this is also a learning for rest of the teams as well, how to interact and how your captain really concludes the things together and come to a final answer. So that was only for that reason, because it will be there for our chief for rest of the life. It's virtually recorded and there, and people do take help of that how people interacted and how one came to an answer. So this was just for that reason that we should interact in Urdu or English so that it would be understandable for everyone who's seeing that. Otherwise, no issue. Overall, a very nice technicalities, questions, content, everything was very, you can say, marvelous. And last but not the least, our host, Hamza, really putting life to this whole show together. Okay to Hamza.
Thank you very much, sir. I think we are all putting in a lot of effort, and thank you for your kind words. I think your input, especially from the technical perspective, becomes very important, and our technical team is taking all the notes on that account. And so thank you very much once again. What a great game we had. And we do have Professor Javed Syal Saab. So can we have his comments also regarding the game?
Yes, thank you once again. Usually my impression or what I used to say every week is repetition of same thing. But what I have seen in myself that I'm going to be addicted of this Cardiac Super League for last few weeks. So this is big addiction because you have light work on Saturday afternoon, and after completing all work, I follow this event very regularly. So I congratulate A.K.U. Stars. So they did very well, but not the least, the other team has also fought very well. So it's very interesting competition. because they have still chance, because these are league matches and they might have got chance in future to be the for semi-final or finalists. So I wish best of luck to both of teams. So definitely I'm enjoying this session, and weekly meeting with Professor Isaac from UK. Still he's in UK, I think.
Thank you
Thank
very
you,
much,
Hamza.
sir. And we do have Professor Hafizur Rahman Saab on the show, sir. Can we have your input as well? Thank you very much. Sial
Yes,
Saab.
please.
Sure, sir.
It was a great game. It was a great game. I enjoyed a lot, and both sides played very well. And I congratulate Wilson Pharma for arranging such wonderful activity and excellent audiovisual. And I think so. These activities should continue at a regular basis. It greatly help in grooming and passing the final exam of our PGs. Thank you.
Very right, sir. And I think we are extremely grateful to you and all of you rather for your time. So we do have Professor Abdul Hamid Siddiqui. Siddiqui Saab, are you there?
Yes, I think very good learning activity, good clinical scenarios, nail-biting finish. Congratulations to both the team and very good moderation.
Thank you very much, sir. It's always great to have you, and your input is always refreshing for all of us. I think we are all giving impetus to this show together along with the technical team. And with this, I think last but definitely not the least, Professor Muhammad Ishaq Saab. He's the pivot that we all revolve around. So, sir.
Hamza, we have Dr. Amber as well. I think you
Okay,
can
okay,
take
yes,
first
yes,
Dr.
yes,
Amber
we
and
do
then
have, we do have.
lastly
So I beg your pardon, Professor Amber. I think she's there. Ma'am, we would like to have your input too if you're there.
Thank you, Hamza, and thank you, Fawad. It's really a wonderful exercise, not only for the PGs, but all of us are enjoying it day by day. Congratulations to the team, especially the moderator and Dr. Fawad. आप तो रूए रवा है और जान है हमारे पाकिस्तान कार्डियक सोसाइटी की तमाम एक्टिविटीज की। पश्तो वाली बात मैंने मस्ती में कही थी आपको कि वो लोग तैयार नहीं है, ऐसे ना हो कि और कंफ्यूज हो जाए। और AKU की टीम की तो कोई बात ही नहीं है। हार्टिएस्ट कॉन्ग्रेचुलेशंस टू यू and all the best institute and the teams. You are really a role model and motivation for the institutes which are growing now. And congratulations to my own team. Basically, in the last moment, how they manage, four of them, to come and agree for this. Salute to you as well. Really, I enjoyed to see Professor Ishaq Saab, Javed Sial Saab, and Dr. Sohail after such a long time. But these type of the activities should be continue for a learning journey. And we appreciate the Wilson team, what you people are doing. One thing which Dr. Fawad Farooq has highlighted, the answer should be on the large screen, because most of the time we people are by ourselves, we are finding out the correct answers to that thing. Thank you very much for giving me an opportunity, and it's always wonderful to be among all of you. Take care, stay blessed. Thank you.
Thank you very much, ma'am, for your input. I think some very important points. The technical team will ensure that, because I think everybody gets involved, and even the spectators and even our panel is in their minds they're answering the questions and everybody is learning. So that's a wonderful activity. And we do have Professor Ishaq Saab. So can we have your thoughts?
Thank you very much. I'm still here, and I think my distinguished colleagues have already mentioned key points. I would like to congratulate both the teams. They did very well. Both the K.T.H and A.K.U are my alumni. I was trained in K.T.H and I served A.K.U. So it was a pleasure for me to see both teams fighting. I think one or two questions were quite simple, straightforward, and I don't know why the K.T.H team got a little bit confused. But overall, the standard of questions and the structure of the scenario was quite standard. I would say that was the scenario B was slightly difficult, but again, you can't be 100% equal in both scenarios. So both the teams did very well, and as my colleagues have said, it's a learning experience for us as well. And each Saturday, this is a sort of breakfast feast for us to go on this live match. Regarding the language issue, I think internal discussion can be in any language. This is just informal. They talk among themselves to find out what's the right answer. And if they feel comfortable in their own language, I don't think there should be any harm, because this is a sort of off the record thing. What they come to a conclusion, answer, that is important. So I think we shouldn't be too hard on language. But the screen issue is, I think, a valid issue. We should have a large screen for the answers also. And I think I would like all my colleagues to please point out some of the fallacies that may be there in the questions and the formation of scenario, because we need to keep on improving and making it more rational, more scientific, and more logical for our teams to answer. Both the scenarios were day-to-day cases, and I think such cases need to be repeated again and again, so that the knowledge of our practical clinical approach should be assessed on these matches. So with this, I think once again, I'm grateful to all of you for having me. I think I haven't missed a single match so far, and we enjoyed Dr. Hamza's moderation, which makes it very palatable and very interesting. And thanks to all of you, Professor Farooq, Amber, and this is how we meet among our friends also. So I think it's a great event for us each Saturday morning. Morning here and afternoon in Pakistan. Thank you very much, all of you.
Thank you very much, sir. Like always, I think it was a thorough and wonderful input from you. I think we all wait for this moment. I mean, I jumped straight from the cath lab just for this very show, and it's such a relaxing thing after a hectic day's work, and it is so refreshing for all of us. We all learn a lot. I think this show is evolving every single day. We are learning things. Whatever goes on here is constructive, and we are trying to improve each other and push each other to the limits, and we all know that sky is the limit. So I think today's match was a wonderful match once again, and the stars, the A.K.U.H stars, they did a slightly better job. But then again, you see, what I saw in K.T.H thrillers was something fantastic. I see a lot of spark in them, and I think in the rest of the tournament they're going to be a tough team to beat. So the rest of the teams, beware of them. And with this, we come to the end today, and I'm going to sign off right now and hope to see you next week with another tough match, another difficult match, and a wonderful game with all of you. So take care. Allah Hafiz.